Yes, special greetings from C.N.H.C. national and international branch to everyone around the world. This educational platform is for people who are in search of finding different views and perspectives in order to overcome their health challenges naturally and effectively. The purpose of this platform is to provide a learning environment, raising health and healing awareness for the public. We preserve, protect, and transmit the true knowledge, correct information, healing principles, natural law, healing ability, and curing concept in human beings. This platform started as a national movement in Canada, and we had 6 great campaigns with the Canadian team, and we are expanding it internationally because we are not separated from the world. This platform is for everyone, everywhere, and anytime to watch and learn about what we share. In this regard, the Bioquantum Academy Canada collaborates with national and international educational institutions inside Canada and around the world. We attempt to bring a natural evolution to the medical field and fundamental understanding of natural medicine to the public. We keep grouping, advancing, evolving, and offering the newest scientific development in the domain of natural medicine. We welcome experts around the world who can create subgroups under this platform in their own countries. Thank you very much, everyone, for joining today. It's awesome to see you all. Dr. Grant, Dr. Pangaj, Dr. Steve Chiola, Dr. Claire Field, Dr. Clark, and myself as well. It's great to have you today. So as you know about the topic, it's about detoxification and drainage. Actually, it's part 2. We covered the first part last time, and because a lot of demand on this, especially the recent situation that had happened from the past 3 years with what's going on around the world. And I think the demand is high, and we are going to again talk about detoxification and drainage. So I would like to know who would like to go first. Do you want me to go first, or I can pass it to one of you?
We want you to go first, Dr. Parveen.
Okay. Okay, great. Okay, let me just talk a little bit about the science, as we are divided almost in everything around the world. So is the science, and people want to know which science is a true science. It's the science of synthetic drugs, such as artificial inoculation, or the science of natural approach, such as homeopathy and naturopathy and all the modalities that you guys practicing in regards, for example, to natural innate immunization by homeopathic nostrils, for example. So nobody owns the science, and science is the data, information, and knowledge belongs to the nature and the cosmos, and we only should discover it. For example, I'm a homeopath. We discovered homeopathy by proving on human beings instead of mice. I just want to tell the public the difference between our domain and the mainstream domain. So our proving is being done on human beings, not animals. If they are made from natural substances in nature instead of artificially made materials in laboratory. We follow human healing principles. And we have the fundamental understanding of the concept of curing human beings. We're following natural laws instead of keeping people on synthetic drugs for the rest of their lives, or imitating the information, copying them and artificially synthesize them and call them biology science or chemistry science or gain of function science. We work the way nature is dictated and programmed it. That's why we are talking true science here based on whatever we discovered in nature. So as we know, nature always wins. This is not something that I am here to prove, or we are here to prove. When it comes to the human internal health and healing, especially in chronic diseases, in all forms and aspects, the science of artificial always losing. But the science of natural medicine always wins because it's based on the natural concept of cure and philosophy of healing. It's period. But having said that, we always appreciate any system of medicine, mainstream medicine that can help, but we are always going against that if they harm. So we are here to call for integration, collaboration in order to help humanity. Thank you so much. And let me just talk about detoxification a little bit about the topic. We are living in a modern societies. We call it modern living, that unfortunately has become equal to unnatural living. We are living in a world of toxins. We are constantly exposed to thousands of harmful chemicals, which are officially actually registered by EPA, Environmental Protection Agencies. There are thousands of toxins that on daily basis we are inhaling or we are ingesting. These toxins are in air, in food, in water, in cosmetics, in hygiene products, household cleaning products that people use on a daily basis in high amounts. And plus the consumption of long-term chemical synthetic medications that unfortunately it's happening around the world in the past century and actually more than century, 125 years. And on top of everything, the artificial inoculation from day one at birth. So, and we, as we know, also with the advancement on the technology, the electromagnetic excesses around us interferes with the human natural electromagnetic field that causes a lot of internal toxication and affecting the human body's homeostasis. And also in modern society, stress and distress, it became some part of actually a normal part of their lives, which is never going to be normal. So at this point, a lot of demands on this topic from so many people that they reached out to me, and some people they missed the last time our meeting. That's why I asked all the experts today to talk about this topic from their own view and perspectives, that people can learn from all of us, and whatever is the best suited for them or available, accessible, and affordable for them, they can do their own research and kind of try to help themselves to detox themselves. So the past 3 years, as we know, the whole world become very intoxicated from all aspects of humanity, from physical aspects, mental, emotional, and people are to a point that they're very hopeless, and they want to hear new perspective, new views. That's why we are here. I'm going to pass it to another expert, and then I continue. So who wants to go next?
I can go next. That's fine.
Okay, Dr. Grant, go next.
Thank you, Dr. Parveen, for the invitation. Glad to be here.
You.
And basically, my website explains everything about my bio, academyofwellness.com. I became actually a scientist before I became an integrative doctor specializing in integrative medicine, functional medicine, and lifestyle medicine. So when I look at things, I look at it from the eye of a scientist. And I've been doing this for 50 years. I started at age 22. Yes, I'm 72. I know I look younger. Thanks very much, because I practice what I preach. And you're going to see it on the academyofwellness.com. Our motto is we care, we serve, we educate. We do not medicate, we do not operate, we do not amputate, we do not irradiate, we do not do any of the stuff the allopathic medicine is currently doing. I have nothing against allopathic medicine. I have nothing against big pharma. I did work for the pharmaceutical industry for many, many years. And I did work with lots of physicians, surgeons in my career for 50 plus years. I did work for the FDA, CDC, and Health Canada for 10 years. I was a professor also in the field of pharmacology, toxicology, microbiology, and analytical chemistry, in those fields that I did my career on. So I'm not going to talk about me. I want to talk about what Dr. Parveen introduced about Um, what is the real medicine here? Okay, so the answer is this. Let's go back to about 5,500, 6,000 years ago. What have they done then? Who is the first doctor in the world? We're talking about now ancient Egypt, the oldest culture that I happen to be belonged to. Was born in Alexandria in Egypt, and I lived in Canada for 50 plus years. So I came here at age 21. So in ancient Egypt, they actually practice natural medicine for 5,500, even 6,000 years ago. And that was the medicine that was practiced by Dr. Imhotep. He was the first doctor in the world. And then if we look at what Dr. Parveen was saying about homeopathy, Dr. Samuel Hanahan was actually a physician when he talked about homeopathy. So how did we survive for 6,000 years without medicine, which only existed for 200 plus years? So basically, the real medicine, and when we go to ancient Egypt, the Roman Empire, India, China, and all of those countries that preceded the introduction of pharmaceutical, pharmacology and the medicine that we have today, that's how we existed before. So we have to really pay attention to this, because if you think that medicine is the only thing that is evidence-based, I tend to disagree. As a scientist, I think if we survived for 5,500, 6,000 years ago, obviously the evidence is there. And if you look at the Ayurvedic medicine in India, if you look at traditional Chinese medicine, if you look at the Roman Empire, I mean, evidence is crystal clear to me that they did survive without any prescription medicine. Yes, they did survive without aspirin, Tylenol, acetaminophen, which is over-the-counter medication used. And then when you have deficiency on those medications, for children, we have a problem. We've got the alarm is sent out. We need those medicine. No, we do not need those medicine. I'm sorry. I'm a pharmacologist. I'm a toxicologist. So you have to look at the primary effect, the efficacy of this medicine, and also the side effects. You have to balance both of them. And if the benefits exceed the risk, then I'm all for it. But if the risk exceeds the benefits, then I'm sorry, I'm a toxicologist. I'm totally against that. So if you look at any chemotherapeutic drugs that are available on the market today, actually, if you look at the science, the risk exceeds the benefits. And I did work with so many physicians and scientists like myself. And by the way, I do hold 3 doctorate degrees. The first one from University of Toronto, 1995. Can't believe it was 25 years ago. Makes me an old senior citizen now. But yes, and Doctor of Integrative Medicine and so on. Anyway, you look at my bio at the academyofwellness.com to get to know who I am. And I fully agree with Dr. Parveen about her observation about the importance of detox. As a toxicologist, I see the importance of cleaning our body from heavy metals, from any parasites, from any bacteria, fungus, yeast, including candida and all of the other yeast infection that we suffer from. And we're exposed to this by air, from food, from toxic chemicals. Even if you look at your own home, if you have any product that ends with X, like Talax, Clorox, Javax, Windex, Purex, any one of those products, they're toxic. And if you don't know how toxic they are, contact me and I'll tell you how toxic they are, because I'm a toxicologist, all right? And then simple things like medications, sometimes we think only of what they used for, but not with what is the really side effect of them. So as I mentioned earlier, if the side effects exceed the benefits, then you have to be thinking twice about this. Let me just ask you this. What do you think is the side effect of homeopathic medicine or natural medicine or integrative medicine, functional medicine, lifestyle medicine? Minimal. So what's the side effect of the current pharmaceutical, things that we have today for the past 200 years? Huge. So you have to balance that. You have to look at it from a scientist point of view, like me, okay? Or like Dr. Shiola, or like Dr. Clark and Dr. Mahorta, or Dr. Parveen. You have to look at it from the eye of a scientist. You have to put it under a microscope to see exactly what it's doing to your body. We can talk about vaccination. We can talk about the, for hours about this, but I'd rather not to. Because they're actually not called vaccination with the COVID-19 experimental vaccines. They're not vaccines. They are actually nanotechnology. I'm not going to even go into this because of my previous work experience with Health Canada and the FDA and the CDC. I don't want to get shut down here. But you have to look at the benefits and the risk. And then you have to look at also what happened with the graphene oxide, the spike protein, the HSCRP, what happened to the clotting. you have to look at the whole thing before you decide what you want to do. And you have to look at how we can detox. If you ever had the vaccination, is there any way we can detox? Absolutely. I've been doing some research on this topic, and I'm using something called stem cell technology to clear the body out of graphene oxide, to clear the body out of spike protein, to reduce HSCRP that can cause inflammation in the body. I mean, this is all scientifically evidence-based. I mean, I'm talking about things that are published, they're proven, evidence-based. I published only 250 papers. I only have 3 doctors, 3 masters, and 3 bachelors. I only written 25 books. So I'm not really a top expert in this field, but I'm starting to learn now. And I'm planning to probably live till age maybe 101 and beyond, even though I have a family history of heart disease and high blood pressure and so on in my family history, depending on medications. I lost my mom at age 45 when I was 18 years young. And I lost my father in his early 60s. And I'd never seen my grandparents. Yet I have decided to practice integrative medicine, functional medicine, and live to the 101 and beyond, because I practice what I preach to my clients. It's only 25,000 clients worldwide. As Dr. Parveen was saying, I help them first to clean and detox their body from water exposure, food exposure, chemical exposure, bacteria, virus, all of the stuff that you talked about, cleanse and detox, and then nourish and protect your cells. By the way, in natural medicine, we talk about healthy cells build healthy tissues to make up healthy organs, to make up healthy systems. This is the bottom up, not the top down. Well, that's how you build a house. You have to put a foundation first, and you put the walls, and then you put the roof. Unfortunately, in allopathic medicine, we have a specialist in every system. We have a cardiologist, we have a nephrologist, we have a psychologist, we have a cardiologist for every system. But why do you have to focus on systems if our health is started with the cells? And I'm sure all of the other doctors coming after me will validate that scientifically, especially Dr. Shiola, because I heard him. I was very impressed with his talk last time, and he's going to validate what I'm just talking about scientifically here. And he's very well-known expert in this field. So without taking any more time, Dr. Parveen, this is my view about detox, toxicity, and what is the real medicine, and who is the real doctor. By the way, the word doctor in Latin means to teach, not to prescribe. Because in the States, we have even nurses who can prescribe medicine. They're not doctors, because the word doctor means to teach. So in Canada, unfortunately, we have what's called a free healthcare system. The physician spends with the clients less than 5 minutes. Now, if you're Albert Einstein or Nikola Tesla, or one of the most genius people ever lived, you cannot solve any better problems in 5 minutes. Dr. Parveen and myself and Dr. Shiola spend at least 1 hour with every client that we see. Right, Dr. Parveen? Right, Dr. Shiola? I mean, you cannot solve anybody's problem in
3
5
hours.
Oh, exactly. In her case, it's even longer. So, by the way, in Canada, if you have 4 diseases, you have to see the physician 4 times, because it's covered under our free healthcare system. It's not really a free healthcare system. It's a free sick care management. That's what it is. And I would challenge any scientist, any physician, any surgeon to arm wrestle with me on this, okay? So you cannot solve any problem in 5 or 6 minutes. You have to listen. You have to do the underlying root cause of their challenge. It could be detox. It could be mental. It could be physical. It could be both psychological. It could be all of the above. So that you look at all of it, and you cannot do this in 5 minutes or 6 minutes or even 1 hour. Dr. Parveen spent 2 hours. Dr. Shiola spent at least 1.5 hours, and I spend at least 1.5 hours to 2 hours with my clients to go to the root cause of it. So that is my short version of what integrative medicine, IM, functional medicine, FM, lifestyle medicine, LM. That is what I'm talking about. Thank you, Parveen, for the opportunity to be part of this wonderful panel.
Thank you so much, Dr. Grant. I've always, as the other expert, I think I explained that last time, Dr. Grant and I think we know each other for how long? Almost 2 decades.
I know you when you were a teenager, okay?
many years, and we used to work in the same organization, PhD department. Yes. It was a great time. We had a lot of international conferences together. Yes. And I know him so well, and he knows me as well. So that's why I always privileged to also hear your knowledge, which has been very helpful. So as Dr. Grant said, we are not against any system of medicine here. We are against something that, as Dr. Grant said, is harming but not helping. And also, the system of medicine has been monopolized. The last 125 years has been monopolized. You cannot monopolize system of medicine, and plus, you making this is not medicine when you make it, in the laboratory. The synthetic materials that should not be called medicine. Medicine is every single food, every single herbs in the nature. That's called medicine. Medicine means something that heals you.
Yes.
Not
In fact,
harms
I agree
you.
with that, Dr. Parveen. In fact, the original medicine, let your food be your medicine and let your medicine be your food.
Your food.
If we all follow this, we would have no sickness in this world. If every one of us follow that model, all of us will be healthy and we can live, forget about 101, we can live till 111 minimum.
Yes, that's what I always say. The reason that we are here, we want to change the concept of healthcare. The healthcare is not whatever is running is a sick care, and it's a failed methodology. It's been failed because they're managing the sickness, they're managing the symptoms. Healthcare starts from your kitchen, in your home. So when I say we were establishing global healthcare with this platform, it means your healthcare starts from home. That's why we're trying to educate parents to be their children's physicians, to be their own, to run their own healthcare in their home. So what they did, as Dr. Grant said, 3,000 years ago, we have doctors, mechanics to go for the kidney, for livers, for lungs, we are not mechanics. We have holistic approach, means human body is the whole unit and operates all the organs, all the tissues, all the cells, they operate harmoniously in collaboration with each other. There's no separation between this organ and this organ. As I always say, for example, liver and skin, they're like a husband and wife. They have very intimate relationship together. So that's why when the liver is overloaded through tantrum on the skin, when the patient comes to me with a skin disorders, the very first thing I look into is the liver. So that's how the human body works. Unfortunately, we are against the approach of separating the human body's unit into different units, such as this, and treating. That doesn't work. And not only doesn't work, it harms for lifetime. Yes. So you can't treat the kidneys without understanding the collaboration between liver and kidneys and lungs and lymphatic system and all those pathways. We are working on the human internal pathways. That's the modality we all practice. We are not mechanics. We don't work. That's why we are against. So, and also, if something is monopolized, we call it mainstream. We are not against any allopath. We are not against the medical doctors. We are against the concept and the pattern and also their trainings as well, that we are nobody, but they are somebody. So people don't need somebody. People need to be educated. As yes. Dr. Grant said, doctors means educators. Yes. That's why we are here. That's why we're trying to educate the public. So, and get back to the topic of toxication. So as Dr. Grant mentioned about vaccines, now it's a topic for the past year and a half. So I went to Oxford University and I found this 20 pages of ingredients of the Pfizer and Moderna and Johnson & Johnson vaccines. And it just blew my mind negatively. And I could not believe it, that anybody who's under oath can inject this to people, to a human being, even 1%. I cannot understand I can't imagine. I can't imagine a doctor.
I can imagine it very well.
Yes,
I'll tell you why.
I pass it to you later. So I can't imagine if somebody, for example, Dr. Kilafir or Dr. Clark, who I know their heart and soul is treating people, helping people, can do this damaging injection. So I learned that about the ingredients for example, polyethynyl glycopg and polysorbates that they have it in Moderna, Pfizer, Johnson & Johnson. I have a file from my childhood that I am super allergic to these two ingredients, which I had no idea that was not the reason that I was against this investigation or drug injection, but because I just wanted to learn more about it. That's why I did a thorough research on it. These are the main ingredients that cause anaphylactic shock in so many people, and it can cause immediate death if it's not addressed quickly. So, and also I found, we knew that even conventional vaccines, they have aluminum, mercury, and a lot of different, such as MF59 oil, urea, glycerol, with so many different chemicals. But I had no idea that these vaccines have cholesterol and antibiotics. This unbelievable, on top of sodium borate, on top of the sodium adipate, on top of all this. One of them that is alarming is oxidizing methanol. So, and plus, how do they make it? Such as recombinant DNA technology, human cell strength, animal cell strength, which is, to me, it's very inhuman. But forget about that part. That it's to me as a person, it sounds very inhuman. But when it comes to injecting it into people's without even going through a clinical trial, and it's not, as Dr. Gilan, it's not a vaccine, it's just a kind of biotechnology. They didn't even isolate the spike protein of the virus. As to my knowledge, I don't know if any of you have more knowledge, please just offer it here or correct me. But as far as I know, it's completely synthetically made with all these ingredients. So it is going to be a toxication for life.
Yes.
It's going to be toxication for life. This is very serious, very serious. On top of the food, the air, the water is full of toxins, and plus the past 3 years, they created so much fear, so much panic, so much negative emotions in people that I would pass it to Dr. Steve to talk about it. And now the humans around the world is super toxicated. If we don't do anything now, the next few years, after 5 years, we're gonna face a huge destruction.
Yeah.
So I pass it to Dr. Steve to have your talk.
Well, 2 things before I talk about emotions. First of all, it's very serious that we still hear the word vaccine, especially applied to what they're using for our viral friend of the last 2.5 years. I'm not going to say the name so we don't get cut off.
Yes, have to be careful.
That has nothing to do with vaccines. Now, I come down my line. I've worked for pharmaceutical companies in phase 1 human research on healthy humans. And to just be able to reallocate a statement for a drug, it would take about 4.5 years of back and forth with the health ministries and doctors and this, that, and the other, just to say, okay, you can do the research. Now, you see, Dr. Pravin, the saddest part of all this is that people protest against guinea pigs. I have nothing, I don't like research on animals, but unfortunately at times it is necessary. But they haven't realized yet that within the last, I would say 4 years, and the last 3 are a very strong example, we are the guinea pigs. Because they would never, ever be able to get if it wasn't called a pandemic, and therefore it goes above pharmacological legislation and medical legislations. There's a new type of rule that you have to use for the pandemics. They would have never, ever been able to get a human research phase 1 study on a substance composed in that manner. We had problems getting a phase 1 study with one molecule, with one substance. Okay, so what I'm saying is, it doesn't amaze me. It saddens me very much. It saddens me also to hear that people still talk about vaccines. There is nothing that is not a vaccine. I wish they would go back to the basic laws of immunology and go back and study what a vaccine is and how it is supposed to be made.
Yeah.
So, I mean, we've lost it totally. Second, doctor means teach.
Yeah.
Okay. And I, for the last at least 15 years, have been trying to teach people that they do not need doctors. And there's one simple reason they do not need doctors. They have to become their own doctors. They have to teach themselves. But that takes on responsibility, that takes on knowledge, that takes on learning, that takes on being careful. And the people are not willing to do that. The amount, the percentage of the human population, let me put it this way, the cultured human population, call it United States, call it Europe, call it Asia, call it whatever you want, they do not realize that we have to stop asking for the health system to take care of us. And we have to start looking in, how do we take care of us? Which means, you know, I told the family, I had a family of 5 kids, mom and dad, and their beverage during the meals was Coke. And each one of them had skin problems. They had intestinal problems. And the mother was a nervous wreck. Coca-Cola is a neurotoxin. And, you know, we have the responsibility of teaching them to take care of themselves. We have the responsibility of bringing them back to natural medicine, definitely. But they have to understand that you cannot go to natural medicine when you have a stage 4 or a stage 5 cancer. You can work on it, yes. I'm not saying we cannot work on it, but we have to teach them to go to this way, way before. And I'm going to share my screen. Can I, Dr. Parvin, a minute?
Yes, please.
Just 1 minute. I'll get to you in a second. Sorry, I made a mistake on that. There we go. I need this. I need this. Go. And I need my eyeglasses. And in traditional Chinese medicine, they say you need your eyeglasses because you spend too much of your lifetime in a rage of your liver, which is anger. And look at the epidemic of people wearing eyeglasses. When my parents, the eyeglasses were, you know, yeah, okay, we have to wear glasses, but it wasn't a big deal. Now we have kids of age 4 wearing eyeglasses. Anyway, emotions. We want to talk about the emotions. Okay. Emotions are the basic stepping stones of our life. We start living emotions when we're in the mother's womb. We're not even outside yet, and we live the emotions, which are amplified through the embryonic waters. So the emotions can be nourishing, or can be toxic. And when we talk about toxicity, we talk about a factor that has to do, and I love the word for sickness in the United States, dis-ease. Now, disease doesn't mean a sickness. It goes way before the sickness. There is something that is not in ease, that is unbalanced with my emotional state, because not a, I don't want to be.
I think we lost Dr. Steve.
Do with the fact that our body cannot. Do you hear me?
We keep losing you, Dr. Steve.
Now
Now you're back. Now you're back.
I was saying that emotions is the baseline for the beginning of our sicknesses. It goes way back in time.
Yeah.
A child who has an emotional problem with his parents will sooner or later, if this continues and it is not addressed, resolve in a gastric ulcer, which if it is not continued and addressed and taken care of, we will eventually find a problem in his liver. So we have to understand that when we talk about emotions, and in my case, I talk about essential oils, not to talk about herbal medicine, but essential oils. I cannot talk about emotions without looking at Dr. Parvin.
I think Dr. Steve has a little bit of internet issues. I hope we're not going to lose him.
I have the same disease, but her problem is different because she's developed it in a different way. And this is how nature addresses what we call diseases. So how come the influence of fragrances is so important? Well, because we know that it's got a physiopsychological aspect in everything, in every sense of nature, and especially the fact that fragrances, we breathe them in and we have an immediate reaction. Now, if we think about aromatherapy as a word, we're working as a therapy with aromas, with the volatile part of the essential oils. And these volatile particles, which we find in the air, and I'll explain why we find them in the air, is something that works on our physical, our mental, our spiritual well-being. Now, this definition does not come from me. It does not come from my teachers. It comes from the National Cancer Institute, the NIH. So if they know it, how come a lot of them are so against what we're talking about? And this is something that I find very ridiculous and very saddening, because this definition, like I said, I picked it up from the NIH, National Institute of Health, and it comes from the National Cancer Institute. So it makes us think a lot. Now, we have to also understand that when we talk about a fragrance, we're talking about a molecular weight chemical, which is less than 300 Daltons, which is very small. It is so small and so lightweight that we can pick it up through vapors. And that's why we distill the oils through a vapor. We do not distill oils that we're going to use for aromatherapy through solvents or chemicals. That is reserved for the cosmetic areas. These molecules go into our olfactory system like nothing. It just passes through. What happens is the molecules will attach to the receptors, and we'll see what's going to happen after. Now, without going into how to use them, how is the best way, what I want to make everybody understand is that when you diffuse something in the air, and it's coming from nature, we're diffusing molecules. We're not diffusing something that we don't know about. And those molecules will work on your limbic system, will work on the release of neurochemicals and hormones, and will run on an emotional modulation. We do know, and science has demonstrated, and this isn't the platform to bring out the science, but I'm just going to talk about it, but we have the scientific articles. We know that the neuroendocrine and the endocrine systems are involved in regulating olfactory learning and olfactory sensing. And olfactory learning and olfactory sensing also regulates and modulates the neuroendocrine system and the endocrine system. So it is actually a loop that we cannot think that it's going to be different. You breathe a beautiful rose. You're not only breathing the molecules of the scent of the rose, you're breathing the essential oils that rose is releasing. It connects, and that will involve structures in our brain, thalamus, amygdala, hypothalamus, and so on, that are involved with emotions, motivations, regulations of memories and of hormones, our sleeping habits. And, all of this is very simple. But unfortunately, they think it's too simple. They forget that, for example, and I thank you for the prayer, Dr. Clark, that you said at the beginning, but also in many sacred scriptures, there's the sentence that more or less goes like this. If you remain innocent as a child, yours will be the heavens and everything within it. So why are we complicating our lives? Because we're not teaching correctly, not us, but in general. But let's get down to some brass tacks. The sense of smell will modulate your mood, will work on helping to counterstop the stress effect on our body, on our central nervous system, will help us work better. And working better means our brain and our body, not physical work. And all of this will bring out to a much better social behavior. Now just think, we've got a very bad social behavior because we don't have enough working capacity, because we are very stressed and very intoxicated, and our mood goes from 1 minute to another. Now, this can be demonstrated on a scientific basis. Chemicals that are in the essential oils, that are natural chemicals, reach the brain anywhere from 9 nanoseconds to 22 seconds. Reach the bloodstream anywhere from 2 to 10 minutes. This is especially when you use it topically, okay? And once it's in the bloodstream, gets into every cell anywhere from 20 to 40 minutes. Now, just to give you a fast idea, this is a research that was done on how, after a 10-minute massage using lavender oil, they measured the linalool and the linalool acetate, which are the two main constituents in the bloodstream. So I'm giving Dr. Pavin a wonderful relaxing massage. And the lavender helps her relax a lot. And then after 10 minutes, I start taking blood samples to see what is the percentage of the linalool and the linalool acetate that, when it's combined by our body, is the anti-anxiety, is the anti-panic, and so on. And we see that within the first 20 minutes, we have the maximum peak. And it slowly starts decreasing, and we still have a good percentage after 60 minutes. So if we want to look at a half-life, the half-life is around here. And we still find a minimal percentage after 90 minutes. So this is for those who say that essential oils do not become systemic and they do not work in the body. Emotional intoxication. Well, what is an emotional intoxication? It's an emotional conflict affecting our physical well-being. And we are seeing so much of this during the last 3 years due to the fear, due to the uncertainties, due to the fact that we've been isolated, and so on. These emotions work on my mind. And my mind will work on my endocrine system, my nervous system, and all the rest, and will give me certain effects. Now, what happens? This is where the fun starts. We say emotions, well, this is where traditional Chinese medicine comes into a very strong point. Your anger weakens your liver. Your grief weakens your lungs. Your worries weakens your stomach. Stress in general weakens the heart and the brain. Okay? And your fear weakens your kidney. So if we look in the last couple of years, what are we doing? We've got a high amount of stress, and we've seen an uprise in cardiovascular problems with problems of both, let's say, thought and vascularity in your brain. There's a lot of worry. I wonder how many people are having stomach problems. And it would be interesting to go and look at the increase or decrease in pharmaceuticals, because the first thing they do is they go and hit the antacids, which is, let's forget it. And then we go into the grief, because the grief, we can't be together. We're losing people. And look at this. It's the respiratory. And if that hasn't been one of the major problems in our dear friend down the last 3 years, this is where we're at, and so on. Now, what I also want to stress is this: emotional intoxication and personal emotional conflicts combine. They sum each other. So I'm living the fear, and I'm angry because I can't go out, and my mom will not let me go out and have a nice day because we have to be isolated, or I can't go to the party or whatever. I can't go to work. I can't go to see my mother. Okay, so we put that together, and the effect on our psychological and physical well-being actually tears our body apart. And what we've been living in, fear, solitude, the social pressure, and the stress, have been taking a toll in our body that is, on an emotional basis, I don't want to describe it as an atomic bomb, but very similar. So there are oils that can be used: lavender, marjoram, Roman chamomile, ylang ylang, Hawaiian sandal, and also vanilla extract, that lowers, and forget about the bottle, I'm not worried about that, but what does it do? It alleviates the tension. Why? Because if you look in the lavender, you look in the marjoram, you look in part of the Roman chamomile, you're going to find a chemical composition between citrates, between linalool acetate, and terpenes that lower the tension. And this is the science. But what we know is that if we put them all together, or even if we just use lavender and Roman chamomile on its own, we're going to also have a feeling of peace. We're going to reduce the preoccupation. So what are we doing actually? We're reducing the emotional intoxication of our body, which is going to have a deep effect on our physical aspects besides our social and mentals. Okay, this is a repeat of the scheme for traditional Chinese medicine, but the repeat here is very important because the fear not only works on my kidney and on my bladders, but it works on my liver. And this, you'd have to get into traditional Chinese medicine to really enjoy it, but it becomes a vicious cycle. One emotion will feed the other. Now, you want to work on frustration. Sandalwood is very good for its composition because it'll help with the aggressiveness and so on. And this is very simple to read. How do you use them? Very simple. Breathe them. You breathe them, or you put them on your hands and you breathe into your skin, or you use an inhaler. And this is a simple therapy. We use it a lot up in Switzerland and in hospitals where we have major problems. We have major problems of depressive states at various levels. The amount of terpenes and sesquiterpenes in here allow us to work on a physiological and electrochemical information to our mind. Remember also that the molecules that are low have a molecular weight, a mass of lower than 500, and essential oils have a mass of, the really heavy ones, I think there's one or two that reach 350 as a molecule mass. They pass our blood barrier brain filter system. So they actually go and react with the various areas, not only with the limbic system. When we talk about preoccupation, bergamot is fantastic. Now, bergamot is a citrus, so we would think that it would bring out a lot of, energy and a lot of push, but there are two molecules in here at a very decent percentage, which is linalool and linalool acetate. And that's why, for example, when I work with patients with dementia and Alzheimer, I will use this in the morning hours to help them in their activities, but also to keep them calm. It gives a long range of vitality. Why? Because as a citrus oil, it's very high in antioxidants. It has a high percentage of D-limonene. If I'm not mistaken, it's around a 93%. And the D-limonene breaks down in our body and helps work on the scavengers. It activates part of our scavenger system. When we talk about fear, juniper berry, which we basically also think about when we have to work with our vascular system, our blood, our veins, our arteries. Well, fear has to circulate to be able to be freed. It works on negative attitudes. There's a whole reason, a whole chemical reason behind this. And I'll be more than happy to get into this in another platform. But today I really want people to understand how essential oils can really work. Look at this. I have anxiety and fear because I've lost, excuse me, I forgot the S in here. I lost my self-esteem. How many people are losing their self-esteem today because they can't come out of what is happening? They can't understand. And we tell them, okay, look inside, don't worry about it, look at yourself, but how can I do it? Well, for example, when we talk about meditation, and I want to tell you, meditation is not just sitting there and meditation has to do with focalizing, has to do with mindfulness, has to do with self-creating a new attitude. And this is this is helped. It's not that uniberry does this by itself. Naturally, you have to help the person, but the emotions help you. The essential oils help you free the emotions. It like liberates them, as if they're like balloons that come out and they just go away somehow. It's not that I'm taking away the problem, because the problem is still there. I'm taking away the weight of the problem in our body. Now, if we want to think about something really strange, ginger is used basically for digestive problems, okay? But it has a very, very strong power on our inner self, on our deepest emotions. It helps elaborate and cleanse the emotion itself. It detoxes. And like I say, there are various ways of all this happening. Now, one last thing, I'm bringing two pieces of science in, because I don't feel comfortable just talking to colleagues and saying all this and not having a minimal bit of evidence. The various fragrances, and this is a beautiful study that was done, affected spontaneous brain activities and cognitive functions, which were measured through the electroencephalographic possibilities. And what it revealed was that the fragrances, therefore essential oils, significantly modulated the activities of different brain waves and are responsible for various states of the brain. Now, this is science. It's not because Dr. Steve or somebody way down when in 2000 before Christ said something about this. Also, another study. There was an alteration of the metabolic profile, in subjects responsive to essential oils. And here we've got, and this is just part of it, okay? Arginine, homocysteine, betaine, and so on. But we also have studies that say that we have modulating effect on dopamine, serotonin, melatonin, homocysteine, and these are all emotional molecules plus physical. So what I'm trying to bring out here to the public is that when you look at an essential oil, you're looking at the most important natural remedy for the balance of your body, because it works on a physical, on a mental, and on an emotional status. I can also state that it works on a spiritual status, but that's even more difficult than the emotions. So I'm going to leave that out. So if we add this into, for example, gemotherapy, or we add it into consciously working together with homeopathy, or we add it into any other type of natural remedies, this is what we're trying to teach, and this is what it's all about. Thank you very much. I'm going to pass the word to Dr. Parvin.
Oh, that was wonderful, as always. Thank you so much. I'm sure people are going to benefit from your talk, Dr. Steve. I would like to pass it to Dr. Clearfield, because I think he has to leave soon. So Dr. Clearfield, are you there?
I'm here.
Okay, perfect. So I think he's going to share one of his cases, I guess, with us.
Yeah, I was not expecting to prepare. I didn't really prepare anything. I was just expecting to sort of listen. Detox is not one of my specialties, but I can learn. However, since I've been drafted, so to speak, I'm going to bring a case, if that's okay. So first off, I'm having a little trouble with the lighting here. Can you see my screen?
Yes, we
Okay.
can.
All right, it's clear?
Yes, it's very clear.
Okay, So, like I said, I didn't really prepare anything. I will be better prepared next time. However, so this young lady was 38 years old, and she lives in Walnut Creek. Her name's Svetlana, which is about 4 hours from where I am. And somehow these folks, as I'm sure all of you know, found me, and I'm not sure how. But she had these complaints: sudden onset of skin burning, a metallic taste in her mouth, brain fog. She was an accountant, and she was pretty much disabled, and it happened in a really short period of time, about 3 months, and major depression. She had all of these complaints, burning skin, major depression, cognitive issues, memory loss, sore body syndrome, muscle cramping, dry eyes, migratory pins and needles, running piglet syndrome, which Dr. Steve, if you know from Chinese medicine, is pins and needles in the hands and feet. I said that once to somebody, and they thought I was telling them that they were dirty, but that's really what it meant. Part of my background is I am an acupuncturist also. Bone pain, especially in her left hip, and she always felt like her hands and feet had like gloves and socks on them. And so these were her complaints, and she'd been to a lot of doctors before she got to me. And just a little bit of background: she was born in Belarus in the USSR at the time, and it's about 112 miles northwest of Chernobyl. And she was about 4 years old when the nuclear meltdown happened. She emigrated to the US in 2002. Not surprisingly, at age 11, she had hypothyroidism. As the winds below where she was, where it was downwind from the nuclear meltdown. And she said many people in her town and her family all had some thyroid issues. She had a thyroidectomy at age 15. She had some ulnar nerve surgery in her left arm at age 32. She drank once in a while. She didn't smoke. Her grandmother had breast cancer, and their lung cancers, coronary artery disease, pretty well typical folks, family history. Let me get rid of that. Okay. The wrong way. She was allergic to penicillin, and she took a number of medications: Celexa, fluvoxamine, which has become popular with the FLCC folks for depression, for chronic depression post-COVID. Venlafaxine, which my students, if any of them prescribe this, that's Effexor, they fail. It's extremely difficult it's extremely addictive. Mirtazapine, doxepin, gabapentin. So all of these drugs, the first 1, 2, 3, 4, 5, 6 drugs that are mind altering, and levothyroxine. So she has a master's degree in business. She was a financial advisor, and 2.5 years she's been unemployed because she can't really do much of anything. In 2017, she began with some breast tenderness, lower left abdominal pain, irregular periods, fatty food intolerance. She had an ultrasound of the abdomen and pelvis. She was found to have a mass in her left ovary, which appeared to have some bony material in it, a thickened endometrium, and gallstones. So those of you who don't know me, my specialty, I'm the hormone guy. So this is, to me, gallstones, thickened endometrium, breast tenderness, and a mass in the ovary. This is estrogen excess. The official diagnosis was dermoid cyst, endometriosis, and cholecystitis. She had an extremely heavy period in May of 2017. Her hemoglobin dropped to 9.8. CAT scan was inconclusive. MRI with IV contrast found vaginal thickening of the endometrium and strange-looking left ovarian cysts. She had the gynecology recommended a hysterectomy, but she had severe bleeding and abdominal pain for the next cycle or two. She had another MRI at the University of San Francisco approximately a month after the first one. And it's also showed that there were blood clots in the vaginal vault. And she now complained 24 hours after the MRI, she complained of left hip pain. Then her mother had a heart attack in 2017, and she went back to the old country. She was given some androgen-weighted birth control pills, and her mother passed away in August of 2017. While she was in Belarus, she had severe hip pain. She had another MRI with IV contrast. And then when she returned to the US in September, she had still a fourth MRI. So this was her fourth MRI within about 9 months. She had a dermoid cyst that was 0.25 centimeters larger than the original one, and her endometrium was 14 millimeters thick. Normal is less than 5. She had a hysterectomy. She had her ovaries removed. She complained of severe fatigue, difficulty concentrating, a burning sensation in her legs. She had to sleep with the sheets off, as she couldn't tolerate anyone touching her skin. She opted out for she complained of post-op headaches, visual clouding, shortness of breath, muscle cramping. 4 weeks post-op, she showed no change in the signs and symptoms. Then she began experiencing hot flashes and night sweats. All of these she was given diagnosis in the 3 years before she was seen by me. I'm not going to read them all, but as you can see, pretty much back in our old country, we would call it mishuganosis. I mean, this is just, somebody just complains and complains and complains. We can't find anything wrong with her. And, it's usually in our world chalked up to psychiatric issues. And you can see she's on 5 psychiatric, antidepressants, anti-anxiety agents. So she had a scar on her right elbow from the ulnar nerve surgery. She had her calves and shins were red, red in there. She had discolored skin in her ankles, knees, and wrist joints. We did the Beck depression scale on her, and it showed severe depression. And we did the anxiety, GAD-7 anxiety, which showed a moderate anxiety. We did our usual routine lab tests and with our hormones, and it really came up with very little. We then sent her for a neurotransmitter test, and you can see here she has very high epinephrine and very low serotonin, which somebody who's on 5 antidepressants, including she was on 2 SSRIs, and to still have very low serotonin is pretty unusual. So other than that, her vitamin D was low. Testosterone, if you're not familiar, the free testosterone, you want that to be between 2.0 and 4.0. And our sweet spot for total is about 30 to 40. So 28 isn't too bad. Her estrogen and progesterone ratio was therapeutic. Her TSH, or thyroid, was in the low normal range. The thyroid antibodies were normal. Reverse T3, we use this as a marker for cortisol or stress hormone. I know a lot of folks use that 4-point saliva test, which is it was very accurate. However, it's a $250 test. This is an $8 test, and they correlate about 95%. So I'm pretty happy with this. IGF-1, we use a proxy for growth hormone, and our sweet spot here is 200 to 250. Pregnenolone is the hormone of memory. Our goal is 90 to 110, and she's actually not too bad at 76. Her inflammatory markers are normal also. Urinary neurotransmitters, I showed you, epinephrine was high, serotonin was low. Low serotonin contributes to mood, including issues including anxiety, depression, anger, and discontentment. And I think that's what most of the practitioners chalked it up to. Now, I hope Dr. Zarins got her and Dr. Steve got their minds churning about what sort of alternatives we could add in here. Low histamine, I was actually expecting high histamine and like a mast cell issue, but it was actually low histamine. We added pregnenolone, which is our hormone of memory. We added some zinc. I should let you know that this was actually pre-COVID, this case. So vitamin D, 5,000 units per day, and we added some GABA, 400. We also added from our neurotransmitter test, we added rhodiola, theanine, P5P and molybdenum, and some SAMe. We put her on some fermented foods, and we added some histidine. So this was our intervention. And she did okay, not great. She did okay. We did a metabolomics test, which is for organic, minerals and organic acids. And oxidative stress was a 5 out of 10. Mitochondrial dysfunction was a 4 out of 10. Toxic exposures was basically 1, 0, 1, and methylation was okay. She was low in riboflavin, so we added a little bit of that. I made a mistake, and so this metabolomics test is from Genova, and they had changed their registration sheet, and they had added in a heavy metal test. And I didn't do it deliberately, but I accidentally checked off to do the heavy metal test, and this is what came out. And this here is off the charts, and this is gadolinium. Gadolinium only comes from 2 places. You're either a gadolinium minor, it's a heavy metal, or it comes from IV MRI dye. And remember, I mentioned that she had had 4 MRIs within less than 6 months, and this was 3 years before, but it's still present. And so here are the symptoms of gadolinium excess: chronic soft tissue pain, chronic fatigue, brain fog, mood swings, depression, exotic infections, fungal diseases, viral diseases, parasites, GI issues, diarrhea, constipation, bloating, food sensitivities, vertigo, migraines, and nervous system dysfunction, burning extremities, numbness, tingling in the skin, paralysis or electric feeling throughout the body. And if you look over here, you can see they pretty much line up pretty well, especially the burning skin. Sometimes you'll get a thickening of the skin and that glove and hand stocking kind of pain. And migratory pins and needles, that what we call the running piglet syndrome. And so gadolinium is a white metal, atomic number 64. It's used as a contrast material to distinguish abnormal structures. It's toxic. It's attached to a chelating agent that renders it allegedly harmless. Renally impaired patients who have IV contrast were exposed to a pro-inflammatory state, surgery, or vascular injury, are susceptible to a scleromyxoderma, a sort of skin thickening type lesion. Gadolinium is contraindicated in patients with a GFR less than, that's renal function less than 30. And treatment, in acute cases is for hemodialysis. There are 300 million MRI scans with gadolinium done over a 30-year period. 8.8 million gadolinium enhanced procedures in the US in 2016. These are the indications for enhanced scans: brain injury, spinal cords injuries, inflammation of solid organs, inflammation or cancerous cells, inflammation of joints, bowels, blood vessel problems. It makes it easier for the radiologist to distinguish normal from abnormal structures. So here is before contrast, and this is a meningioma, and you could probably see it if you look closely, but of course it makes it much easier. There's 2 types of gadolinium. There's a linear or open chain one, and there's a macrolytic one, a ring chain one. It appears that the open chain one were the more toxic. In the package insert, it says it can cause nausea, headaches, dizziness, injection sites, feeling warm. Most of the patients are assured that if this happens, it will pass within 24 hours. Those patients that had hyper intense signals quoted on brain MRI scans are in the dentate nucleus and globus pallidus of the cerebellum. Those are the ones that are most vulnerable. So there is a known system called a known entity called nephrogenic systemic fibrosis. The predisposing factors are the linear gadolinium contrast. One of them, this Magnavist, was a linear agent, and it was much more decreased from after its removal from the market. The onset of time from symptoms from IV contrast to exposure is about 11 days. Now, this picture that I have in here, unfortunately, it's a little bit offset here. So Svetlana had mild skin thickening that sort of looked like this, but it wasn't quite so severe. They're usually bilateral. They have increased fibrocytes, CD34 plus. There's usually respiratory failure with it, and there's a mortality rate associated with this kind of lesion of 31%. So that's pretty severe reaction to an IV contrast dye. IV gadolinium deposition is the more common disorder, and there are A and B symptoms. The A symptoms are brain fog, head pain, dry eyes, blurred vision, muscle fasciculations, pins and needles, boring or bone pain, burning skin pain, which is almost universal with patients who have gadolinium reactions, and a metallic sensation in mouth, taste, smell, and odor. So B symptoms are heart arrhythmias, GI symptoms, tinnitus, loss of balance, depression, hair and teeth loss. Here's just a graphic of symptoms and where they develop. You can see it's pretty much universal. There's nothing specific. Our group has had some lectures from Dr. Andrew Campbell on mold and mycotoxins, and these are pretty much all the same symptoms you get from mold and mycotoxins, and pretty much any toxicity. Again, here are the symptoms of gadolinium deposition disorder on the left and Svetlana on the right, and I lined them up, and they're pretty close. If you read some of the literature, especially from the radiologists, it's kind of brushed off as, again, mass hysteria. And I've done lectures on finasteride. That's the hair loss drug with severe mental changes and even suicide ideation, which is also kind of laughed off as a one-off. So the dentate nucleus is deep within the white matter of the cerebellum. It functions planning, initiation, and control of voluntary movement. The dorsal region is for skeletal muscle function. The ventral region is non-motor function, conscious thought, language, cognition. Special structures are Purkinje fibers, GABAergic neurons inhibiting neurotransmitters. So again, we get IV contrast, which attacks these structures, and you can see that the symptoms that our patient complained about are the symptoms that happen when these structures are damaged. And the globus pallidus is in the basal ganglia. It's voluntary movement, fine-tuned movement, and the neurotransmitter is GABA. So here is the different functions of different parts of the brain. Again, so here's gadolinium deposition here, and we went and looked for it specifically in her, and you can see there's the progression. There's a progression there. It gets kind of worse and worse. Disorders associated with gadolinium or calcium channel blockade, you'll end up with hypertension, inhibiting mitochondrial function, inhibiting calcium activated enzymes, induction of oxidative stress, pro-inflammatory cytokines, interleukins 2, 6, interferon gamma, TNF alpha, TGF beta, pro-fibrotic cytokines, interleukin 4, TGF beta, interleukin 13, and VEGF. Other cytokines involved are interleukins 8, 18, 23, 31, TGF alpha, and oncologic factors also. You get a disruption of thyroid from T4 to T3, decreased thyroid function. These are some of the lectures I've given over the past couple of years. And what I did was I sort of compared the cytokine issues with all of them. And as you can see, there is a overlap on all of these, and you know, we can extend it out even more. So here are the references for the cytokines. So she goes to Stanford and has another test for gadolinium, and they tell her it's normal and that we're crazy. But what the difference is that we were measuring in 1/1000th of the dose of gadolinium than the Mayo Clinic laboratories. Our test was much more specific and sensitive, and so they told her it was normal. And then so we did another test. We did a doctor's data test, and this one came up positive also. So so here is a protocol. We put her on the autoimmune protocol diet. These are the things that are allowed, not allowed. No gluten, grains, legumes, dairy, sugar, no alcohol. We began her on IV chelation, DTPA. We gave her, which is much more stable than for gadolinium than EDTA. You will get a Herxheimer or flare reaction, and so you need to be aware of that. And then there's the doses there. The flare reaction is a hypersensitivity, stimulates the immune system. In fact, if you don't get this flare reaction, you're probably either not treating it with the proper chelating agent, or the dose is too low. We can treat the patient with Benadryl and prednisone ahead of time. That seems to help with it. And we help with the flare reaction, and we use a steroid pack. And these are the cytokine targets. You can use some of these other remedies, the things that we're all familiar with: low-dose naltrexone, quercetin, rutin, luteolin, omega-3 fatty acids, and resveratrol. Also N-acetylcysteine. Here's the remedies. And then if you get the other reactions for inflammatory issues, and again, we're the hormone folks, so we measure hormones all the time. And so we use those remedies. This is a combination. We actually get it off of Amazon. It's $39 a month, and it's a combination of luteolin, quercetin, and rutin. And we treat one capsule per 10 kilogram on weight, and we'll use this for about 3 months. We'll also use some B vitamins, PQQ and coenzyme Q10, fish oil, vitamin C, again quercetin, and the patient is back working. It took us 4 months of chelation and the protocol I gave you, and her brain fog is gone, her skin issues are gone. And she's at 95%. So, like I said, I wasn't prepared, but this is a medically induced malady that is fairly common, actually. I had an MRI last week for an issue, and they handed me a paper that said in 2015 the FDA looked at this and said there was this did not exist. So, anybody have any questions?
Thank you so much, Dr. Pillerfield. That was wonderful as always. Was very academic.
Like I said, I really wasn't prepared. I was just going to be in the background listening. So
we have a lot of questions, but because we are limited to 2 hours and
right.
7 people to talk, and normally we talk only 10 minutes to 12 minutes. So, but this time it was, that was great so far. But I have definitely, I would like to make a comment on the chelation that you usually do. So as I always talk about it, and even last time talked about, we have to be very, very careful when we do chelation, that because during chelation, first of all, we have to shower the person with minerals, because chelation happens when the minerals come in to bond with the toxins in order to neutralize them. And also to move them. But prior to depilation and detoxification, we have to make sure that the emunctories, the main major emunctories such as kidneys, livers, and lungs are open. But that's why I always, in my teaching and in my practice, I always say two weeks at least prior to depilation or detoxification, you have to work on the liver and kidneys and lungs in order to move, because with depilation you move the toxins through a lymphatic system, but you got to drop them behind the walls if the kidneys and livers are not open to eliminate them. So what's going to happen? They're going to back up to the bloodstream, and it's going to be tenfold toxic. So at this point, that's I always I am always careful when I do depilation, but I'm sure Dr. Clifford knows what.
Well, I had there's a radiologist in North Carolina that's an expert on the detox of the gadolinium. So I worked with him, for her, and like I said, she did quite well. It was a surprise to me. I wasn't expecting it. I'd actually, quite frankly, I had never even heard of it before, but now I'm very aware of it, obviously.
I know.
We've actually found a couple. We found 2 other patients since then with the same, they came in with the same, nebulous brain fog, all of the, sort of toxicity symptoms. And they had very high gadolinium levels. So that's on my radar now as something that we look at for everybody, especially if they've had MRIs, IV contrast MRIs.
I know. So yeah, thank you so much, Dr. Kelvin. That was great. Dr. Pankaj, would you like to have a few words? Unmute yourself, please. Yes.
Yeah, so I think hearing from the last session and this session again, the context remains the same, that there's lack of information with the community about, the homeopathy and the herbal medicine, both, at the school level, which you say the secondary education and the higher education. So, amalgamation of curriculum, or maybe, few sessions pertaining to how you can take care of your everyday health with the herbal and homeopathy medicines would certainly be helpful. And, it's not like there were examples of cardamom being used every day, which also acts as a medicine. It's known. It's not known to the community, but you are taking it every day. So, this kind of example would promote the use of the homeopathy and herbal medicines. And certainly, not only this, there might be applications of the use of certain elements which should extract maybe in diagnosis of certain diseases. For example, we are using gadolinium for looking at the internal structures. So same way, not only treatment, but also application in diagnosis will certainly help in spreading the word about, the herbal medicine and homeopathic medicines.
Yes. You know the difference, Dr. Pankaj, between homeopathic medicine and herbal. So, the energy medicine and herbal works at the chemistry level. We call it functional, was working mostly on the organs. But homeopathy is mostly work at the cellular level. So it's they all are compatible. Can work together and put them together, but not at the same time. But they have 2 different functions. One at the cellular, such as homeopathy, gemotherapy, aromatherapy, that mostly works, at the cellular level. But when it comes to herbal, it mostly works at the functional level. So we need both. That's why we're here to integrate, right? And hopefully, when we are a solid group in the future, we're going to come as an integral group that with the different specialties, we can create like a very big, solid platform from all modalities, from homeopathy, homotoxicology, gemotherapy, aromatherapy, herbal, biotherapeutic and functional medicine. Dr. Killerfield is an expert. Dr. Grant is an expert. So we can come up with, kind of whole solid platform under one umbrella. So then at that point, exactly we know who is candidate for what, who is candidate for herbal, for GMO, or with which one, they can have like integral approach with a different, modality at the same time.
Yeah, one of the diffused approach was, I was reading an abstract on Healthy Skin Day. And when I read the whole abstract, it was more biased on, making the skin, healthy, but nothing was discussed about the fact that there are available herbal and homeopathic medicines which would, detoxify and then further help in drainage of certain detoxificants and detoxificants. And but I think this kind of informations which can be released on certain days, where everyone is going to read about health or skin. At that point, I believe most of the applications from the learnings we had today would make more reach out. So it will be like our education reach out to most of the community.
Mm-hmm. Yeah, definitely. So this is an educational platform. Definitely, as I said, when we are coming together, as an integral, group, then definitely we're going to create a platform as an educational platform that it's going to be like all the modalities going to be under one umbrella, and we're going to teach it to different institutions. So I don't know if you're looking for that kind of, approach. So then we are going to do it definitely. So bringing
this lack of, I think when I was teaching medical terminology, I could see, I was teaching the student about medicines, in China, traditional medicines, and then Ayurvedic medicines and some Western medicines. But I think this lack of, vocabulary terms, which also needs to be integrated into the curriculum, so that, not only the students, but also the students who are going to interact with community are educated at both ways. So I think it will be more cross-curricular connections within the student and the community if there's specific terms which are also part of curriculum, rather than having case studies to be taught first, or having more field-based learning with students all together. I think starting at grassroots level would be helpful.
Yes, yeah, that's why we are here. So okay, yeah, Dr. Rosenberg, very welcome. Thank you so much. I know you tried to join, but yeah, something happened. I have no knowledge on this technology. So technology is changing overnight. So sometimes you get up in the morning, you see things that changed when you were sleeping. We try to get to the platform normally, usually, and it doesn't allow us. Something, we have to expect. So thank you so much for joining, Dr. Rosenberg. Last time he was at the global conference, and he delivered an amazing speech on GMO therapy. So I don't know if Dr. Clark, good to see you. Now we see your video. Would you like to go last? We allow Dr. Rosenberg goes now, or you wanna, is that okay?
That's fine.
Okay, great. Thank you so much. So Dr. Rosenberg,
yes,
you can, yes, you can start your talk if you're ready to go.
First of all, good day, good evening. Here is,
Yes.
We are in Romania about 9 o'clock, and after 2 o'clock, I will be in Sydney virtually to participate an important conference on apitherapy. Yes, well, I want to say that first of all, thank you for the invitation to be part in your platform organized and I am interested in the ideas which are exposed during these activities. About detoxification, I want very shortly to say that we discussed some days ago, 1 week ago, about the role of chemotherapy in combination with homeopathy or in combination with other soft alternative therapies. This is the most important quality of alternative complementary therapies. Is not the best name for this natural traditional methods. It's possible to associate different therapies like homeopathy, like aromatherapy, apitherapy, phyto, and so on, and to develop, exist a synergistic effect between these natural therapies. And I believe very much in the possibility which exists, for instance, in Romania, where are great important tradition in the utilization of these natural therapies. I want only shortly, because the time is limited, to say Hahnemann, the founder of homeopathy, was had an important period here in Transylvania, in Dracula land. Yes, in the period only in the period 1777 and 1779, about 2 years, he stayed here. He worked here in the court of the governor of Samuel von Bruckenthal, like librarian, and because the governor had a fantastic a lot of books, important medical books and manuscripts, about 15,000 manuscripts, in where important role had the Hippocrates work. And in these books were mentioned, because Hippocrates mentioned for the first time similia similibus curantur. But he don't utilize only the other aspect, contraria contraris curantur. Yes, and the young German doctor Samuel Hahnemann had the possibility to see and to these old books and to receive the information, after which he developed homeopathy during his medical activity. But homeopathy is really a young alternative therapy, only 200 years in comparison with Ayurveda. Ayurveda documented from 5,000 years, or acupuncture, which exists from more of 3,500 years, or aromatherapy or phytotherapy, which existed from the beginnings of our existence, of human existence on Earth. This is a very good possibility to change informations about different therapies, natural therapies.
Yeah, thank you, Dr. Rosenberg. Yeah, when it comes to homeopathy, as you mentioned, Hippocrates. When did Hippocrates live? Like, how is it?
Hippocrates lived about 3,000 years ago. Was in the island Kos in Greece, in the old Greece, and but he mentioned for the first time this possibility, similia similibus curantur, and also contraria contraris curantur. Hahnemann redeveloped this basic idea of homeopathy, similia similibus curantur.
Yeah, but what I'm trying to say is, like cures like, or curing with similar, it's been around way before Hippocrates. And Hippocrates also, he you know, as we know him, so it's always has the slogans of "Let food be your medicine" and "Medicine be your food." It's something he was emphasizing on nutrition and also like cures like. But since I don't know what happened to the you know, literature. So the literature, because during that 3,000 years, definitely it was in the hands of humans, but the literature were missing. So Dr. Hahnemann found it, and he brought it into establishment. So it doesn't mean, to me, to my understanding and to my knowledge, that I did a lot of research on it, it's during that 3,000 years, homeopathy was serving humanity, but it was not developed the way that Hahnemann brought it into establishment. So, and it made like worldwide and became like a actual system of medicine. Because as I did my research, Hippocrates did like cures alike with the natural, you know, natural medicine and also with food. So, but we missed the literature. So I don't think homeopathy is new. It's not that because I'm a homeopath and I'm a kind of extremist and I try to say that, but it can be a new system of medicine. So that's what I wanted to say. But a lot of you know, things is evolving. We are evolving. We are advancing. We know more about homeopathy, like homotoxicology is another branch of homeopathy. It was born into, since the Europe becomes industrial, you know, from homeopathy. Then gemotherapy is born. You know, it's still, you know, it's a science. Science is evolving as long as it stays truthful to the nature of science, which is that, you know, comes from the nature. It's evolving. So we don't know. Maybe the next 20 years, another branch comes that is born from homeopathy, that they can be absolutely compatible. But we cannot overlook a lot of different good modalities, such as aromatherapy, you know, like a phytotherapy, which I love to use. We cannot, you know, ignore them. They are very compatible, and we can use them. I personally use 4 different things in my practice, which is classical homeopathic remedies. For example, for detox, you know, we have one of the best homeopathic medicines, such as lycopodium, for like a nox vomica, like tuya, like argentum metallicum, We have so much. We have many wonderful good tissues, also, such as nut salt for detoxification. We have chemotherapy, which I have faith in chemotherapy because, as I always say, detoxification is different than drainage. Detoxification, when you bring in the toxins from the cells, you're pushing it in the lymphatic system. Now somebody has to eliminate them. That we do it with homotoxicology, but eliminating it, we get help from their chemotherapy. So that's what I personally can say, that my success is based on that. And because when we understand the process of detoxification and drainage, then we understand what homeopathy does, what homotoxicology does, and what chemotherapy does. And plus oligotherapy as well, because we have to shower the person by minerals. As we know, the toxins have the negative polarities and they bond with positive minerals. So at this point, it needs a lot of minerals during the process. Otherwise, something will break down in the, along the process. That's why we have to do, we have to mineralize the body prior to detoxification in order to have a successful detoxification. And one thing that I always say, not everybody is candidate for detoxification. People that they are in a last phase of malignant phase of disease, such as cancers, such as autoimmune, such as, compromised immunity, we should not do detoxification at all, because something will break down. We have to prepare the body by mineralization and by drainage, first chemotherapy and homotoxicology, then we do detoxification. Personally, I always take the case to understand if the case is kind of candidate for detoxification, because it sounds very common and simple, but it's very complicated for the body. And in a case of last stage of disease, we can do a lot of damage. So at this point, detoxification is a very sensitive and very sensitive topic that we have to be very careful who we are going to offer it. And we have to understand total understanding of the case to do it. So thank you so much, Dr. Rosenberg.
Thank you.
Thank you. Thanks for joining.
It's my pleasure to participate.
Yes,
For
yes.
the first time, I don't know what are the rules, what are the ideas of this type of education platform.
Okay, so I think because you didn't join the early session, let me just talk about it again. This C.N.H.C is created by myself, by Bioquantum Academy, my college institution.
Yeah,
it started as a national movement because Canada was in a very chaos in terms of health and healing. So after this 2.5 years of a chaotic situation, and I never been busy as I have been since last 1.5 years in my practice. They're all coming with super toxication from all levels. So I try to bring it to the public, to bring it to the public, to give hope to the public, educate public, because we always coming to different platforms as experts, as practitioners, as doctors. We're trying to exchange knowledge, but that one is missing. That public were just kind of paralyzing, And at that point, I created this platform to bring it into the public, which was very successful. We had 6 campaigns so far, and we brought it to people, and it was very successful. At this point, I think we have done the job with at the national level, and now I want to extend it to international and bring it to almost everyone, everywhere, where and anytime. So before was limited to to Canada, but as we know, we are the practitioner for humanity. We're not practitioner for country or just for the community. So at this point, I want to extend it. And plus, I know you all that you're wonderful experts that you can be a voice for this modality, for this platform with different modalities. So, but one thing that I will really like to do is just the modalities that are compatible. We cannot honestly cross each other or neutralize each other or go against each other. We want to integrate in a very healthy manner, and because we don't want any kind of criticism or any form of problem. So I'm not saying that we don't want to integrate with allopathic model. I haven't been in allopathic system for, I never used it for the past 25 years. Maybe just once, or 2 times in a hospital because of, giving birth, and another one was an accident, sort of. And I'm not using any allopathic medication for the past 25 years. But it's not that I am fully against it. I'm just against the part that is harming people. But in acute cases, in trauma care, in accident, in surgeries that it's needed, we appreciate it. So we're not going against any model, but we're going against the concept of harming people, because we are operating under oath, and we do not violate our oath and our medical principles, which we have seen these principles being violated since the past 100-some years. Is not only now, but the last 3 years it's been surfacing, is manifesting it with the, all this we see around the world, the chaotic situation is the manifestation of the violation of the practitioner's oath, because they have harmed people, knowingly or unknowingly. They have harmed people. So if somebody just goes for hypothyroidism or hyperthyroidism, either they put them on a medication for the rest of their lives, or just taking the thyroid out is a violation of medical principles. So I am against that, because in homeopathy and so many other modalities, we have answers. And I'm against, practitioner or doctors become mechanics of the human body. Human body works as a unit. You can't separate anything from anything. That's why homeopathy is all about unity of human being as a whole. We are called holistic practitioners. We are not human bodies mechanic. So I am against that. So I'm against a concept and a training, not against medical doctors. Anybody, whoever comes in the field of medicine, by calling or by somehow, whatever the reasons, they have compassion, they have kindness, they want to give it to humanity. But unfortunately, if the training is wrong, that compassion goes wrong as well. So what you see that the last 3 years, it was forced into people's system. These toxins, this investigational drug was forced into people's body. By whom? By allopathic model. I'm against that. And I have been fighting against the wrong, and I'm standing for right. So thank you so much. And now I'm going to pass it to Dr. Clark. Dr. Clark, you'll be waiting for a long. I'm sorry about that. You said that you want to go last. You don't mind. I apologize, but always the last is the best. Unmute yourself, please.
Okay, great. Hold on. There we go. Hoping to hear a backlash on that. Listen, thank you so very much for the opportunity to kind of be on the platform and to kind of come to the meeting of the minds, which, as you may say, I do apologize. You might hear a little bit of background. Here we have one of our famous football games coming on. We're in the South, so I'm going to apologize ahead of time for that. But, this is, again, just this great opportunity to kind of be here and share the knowledge with everyone. I have 2 screens up by intentional, because one, I actually would like to share my screen if I can.
Yes,
and I'm kind of great. And I'm going to kind of talk a little bit about what I did. Well, some of us were not on the previous presentation, and about kind of, what it is that I do in the virtual clinic. And once again, everybody here is just, gives such a wealth of information. It's almost hard to follow anyone's act. So once again, I think the best thing that I can really bring to the table for you is, resources, and how do we set this platform to come together. My presentation is usually from the Wellness Infinity Network, and it is where do we go from here? Wellness to infinity. And networking providers. So therefore, I have developed a corporation called the Wellness Infinity Network to kind of bring us all together. Now, one of the companies that actually supports us is the virtual clinic. And I'm spending more time on that than I am even on the Wellness Infinity Network at this particular time, because of some of the things that you all have brought up, within the presentation here, because the virtual clinic is my backbone. And I'm sharing that resource with you. So as we're all connecting, you will have the resources that I do too. One of the beautiful things about it, it allows, it's built for non-traditional practitioners to be able to order labs and testing. And just like the other doctor had spoken about the galenium test they ordered, and it happened to come up by mistake. Well, in our worlds, really truly, there really is no mistake, because we do have a divine power that is guiding us. But by him having that ability to be able to have access to that test, allowed him to really be able to save her life. And I do believe that. So I'm a true firm believer in testing. And so therefore, being non-traditional practitioners, on myself, as well as the founder, Dr. Tony Brown and Dr. Patel, really want to give a platform so that you'll have access to these particular testing without necessarily having to have a doctor's orders. And we make that happen for you if you'd like for it to do so. So ordering tests, the functional piece over here, as well as, we also have a portion of telemedicine, because I like to be able to connect everyone in that aspect. I truly believe if we're going to talk about equity and equality, what we really have to understand is we have to be able to connect. We have to connect with our patients. And one of the things I know telemedicine does in remote patient monitoring, it allows me to send them equipment to allow them to be able to tap in to me more frequently than me having to reach out to them. So being able to do that, now we're developing this situation to where we're really embracing the patient so that they can really be able to come along with us and be able to be in the folds. And we're really walking this journey with them, instead of them feeling as though I'm giving you information, you take it home and, you do or don't do it. Well, this really enables them to become a partner in the relationship with me and with any provider that allows them to be able to see where they are. So once again, every time we touch a patient, that's an opportunity to educate. And as we are educating them, what we need to be able to do is have them take more responsibility a little bit at a time, actually not a little bit at a time, up front, to be honest with you, but continue to educate them, as we go along, so they really know how to embrace the information we're giving to them and incorporate it into their lifestyle, which is what all this is going to really boil down to, and look and see the difference and the impact that they can really make in medicine. So you look at my slide again, we talk about the virtual clinic. That's how you get into it. Okay, we really move into mental health quite a bit too as well. There are about 350 different tests that we do. We partner with Genova doctor's office. There is a panel on here somewhere, I can't find it at the moment, about all the other different, more or less specialty and integrated and functional testing companies, and bring them all into one portal. So now, instead of like what I used to do, have 10 different requisitions, plus about 20 tubes of blood, for the patient, a lot of times we can kind of combine those a little bit, to be able to, especially the requisition, because the requisition comes in one platform now. So now we're able to give a more comprehensive testing ability for the patient, because at the end of the day, what's going to really be important is getting the correct diagnosis. We've got to have tools to get the correct diagnosis. And I'm not taking anything away from anyone what modality you use at this point to be able to do that. But what's more important is we bring all of this together to have that platform to move forward. So now we're talking about detoxification. We're talking about, all these different platforms that we're using to heal. Let's bring that all together, be able to make this into a tool that patients can use and see, which is one of the things I love about some of the testing that we do. I'm just going to skip past them. Oh, here we go. Functional test. Come back. There you go. So most patients I do know, no matter where they are educationally, will get two things out of their education, hopefully. Number one, they can count from 1 to 10. And number two, they learn primary colors and they understand red, yellow, and green. So with that, we can make a transformational change in educating the patient to be able to be engaged in their own care by breaking the information down to a point where they understand it. And when they're able to see where the values are in the red and see how it moves to the green, that is so powerful for them. And it gives me such a reward, to be honest, because I know I've made a breakthrough. We're on the same wavelength. We're on the same team now. And so I just want to take a little moment to kind of really delve more into, this arena and how we can all come together and share our knowledge on these particular platforms. Becoming a part of this, I am on one of the doctors on the back end of it and actually one of the consultation doctors. So if you're a traditional, if you're traditional too as well, okay? So anyone can actually go on the portal and actually be able to order. But the whole goal is to give you that leverage, that extra tool to be able to help you get to your best diagnosis so that you can better treat your patients. And once again, we all have such a wonderful gift to utilize. I'm not going to give my infinity to infinity model again, but I'm just going to leave you with this. You look in space, there's infinity. You go down into your subatomic area and you have infinity again. So what we have to do is make the best of what's between infinity and infinity to bring the best together for our patients using our gifts. Thank you.
Are you done, Dr. Clark?
Oh, yes, I'm done. I said thank you. So yes, I am done.
Yeah, would you please remove your PowerPoint?
Sure.
That's perfect. Thank you so much. Wow, I see you, Dr. Clark, in 2 windows. Okay, now it's 1 window. It was great. Yeah, so it's a different way of testing, right?
Yes. Because beforehand, more or less, I know here in America, well, and these tests are really geared more towards functional testing, like the heavy metals, looking at the microbiome, surely adrenal testing, for adrenal fatigue. LabCorp is also incorporated into this as well. So you can do all your basic fundamentals like your complete metabolic panel, but it is more intentionally designed for those who are the investigators of health and who are looking for the red herrings. We're looking at the biological system, the biochemistry systems, looking for the biological markers that would give us the tool to be able to give a proper diagnosis or the best diagnosis past what you would traditionally get in just, your regular labs.
Did I hear it right that you're doing it virtually?
Yes.
Okay, I tried to focus on what you're saying, but I need you to repeat it in its short sentence. How did you do it virtually?
Okay, so you can have a platform to be able to order
Oh,
the
okay.
testing, okay,
Okay.
you know, virtually. However, we do have a platform to where we have equipment that would help you to connect with your patient virtually as well.
Okay.
So we have a company that sends out a smartphone along with the equipment, your blood pressure, your thermometer, you know, the things they can utilize to be able to do their own triage kind of in their own place. And then that information uploads virtually into another platform. It's not this platform, another company we work with. So then you can get all the vitals. Now you got all the testing, you know, done, and you can pretty much be anywhere and be able to have a consultation, you know, with a patient and give them the information that they need. The lab does connect with quite a few labs across the United States. So, and even some of the testing can be sent internationally too as well.
Okay.
Sure.
Okay, great. Dr. Clark, I remember your speech, your talk at the global conference last week.
Yes.
You were talking about nutrition.
Yes, yes,
Okay.
yes.
My question is to you, because you are a medical doctor, right?
Yes.
Okay. So what natural modality do you practice in addition to the test that you do?
Listen, I did fruits and vegetables, lean meats and okay. So lean meats and fish, fresh fruits and vegetables, more heavy on the fresh fruits and vegetables. That's my tagline. You know, once again, let thy food be thy medicine, let thy medicine be thy food. I mean, what more can you say with that? I've been very inspirational and been able to bring a church, you know, into a raw fruits and vegetable challenge, which was very, very interesting. Once again, I reside within the southern states. So in the southern states, most of our food, if it is not brown, we either fry it or either we cook it till it is brown. So it's really been a interesting transformation to see how they understand eating raw fruits and vegetables and bringing the phytonutrients that has to your body to help the DNA heal, how big of a difference it really makes. So apart from the testing, what I really do try to encourage is a transformational change in your diet and what you eat. Once again, when you're talking about the detoxification, you know, process, one of the first thing we do is start off with water. And then number two, eliminating the foods that we do eat that are toxic.
Okay. So it's the only way of practicing, or in addition to your medical practice?
Oh, it's in addition to my medical practice. So I am the trained allopathic, you know, for sure, but just my own personal journey has allowed me to understand and know that we need something else besides that. And the body needs more than just that. So with my own personal journey, I started looking at how foods can really affect how I feel and how I function, and believe it or not, even how I look. So when you really begin to look at the diet that you're eating and know the foods that are good for you and know the foods that are not, because everybody's different. We kind of taught this diet, you know, of, you know, your 5 food groups, and, you know, you just, everybody eats the same, but everybody's system is different. And, you know, you have to really be conscious to know your body for yourself and what it needs and does not need.
We are the grandchildren of Hippocrates. Let food be your medicine and medicine be your food, which it's my slogan as well. Like, you know, food is exactly, food becomes you. Whatever you put into you, your intelligence turns an apple, bananas, bread, everything into you. So you are exactly what you eat. I mean, you know, by the process of your intelligence, you know, making a human body, actually. Human body it's made by food. So we call it food body, right?
Yeah, and it's amazing, you know, because one of the things I think I definitely learned for myself when I changed my diet, you know, I actually look about 10 years younger, you know, there's no doubt about it.
Yes, absolutely.
You know, and you look, you feel better, you think better, you do better. And what's really beautiful is when people really do follow the protocol, and it's challenging at first, but, having them to really buy into the concept. And then when they start seeing the change, they get it. And believe it or not, they're not so willing to go back. And it's wonderful.
Mm-hmm, mm-hmm. Me, I'm a nutritionist with the nutrition background and a homeopath. When I try to break it down to see what my health is coming from, and I'm a cheerful person too. It's like, mentally, physically, I'm like a,
absolutely.
I don't want to tell you my age, but I mean, I never exceed more than 25 years.
That's it.
I'm kind of frozen into 20s, but I just want to explain the way my mind and mental is. So
right.
When I break it down, what I owe my health owes to, like I can say like 80%, 70 to 85% is my food.
Yes.
What I eat, because I'm not a restaurant person. I'm not dining out, not me, not my family, or just, and plus what I choose to eat, I'm not claiming I'm a vegetarian or I'm vegan or no, I eat everything, but the combination and what kind, it's very on how much, what time. These are something that I have a biological clock, for example. That's health as well. Like after 6:30, I don't eat anything. I'm
trying to get there. And sometimes
it's hard. Sometimes like on weekend, it's a little bit hard when you have a company. When I have people over, I go somewhere. Oh my God, the party starts after 7:30, right?
Right.
So there are times, but I mean, there are emergency times that your body can cooperate with you. But what we're talking on daily basis, that it's most of our life it's our own daily basis, right? So I'm practically relying on my food, and it's not the nutrition that I learned in university. It's like I'm coming from clinical nutrition background. So
right. Yeah. And let me tell you something. I've really learned something. Of course, every time I come, I learn so much. And listen, Dr. Steve's, talk about the aromatherapy. I'm headed to get the lavender. You know what I mean? And so just these small things that we can really do, these small changes that we make in our lives, adding this layer. You remember one of the things I said, when we talk about wellness, it's not one dimensional. There's an algorithmic equation to it. And so we need a little bit of this, we need a little bit of that, we may sometimes need it all. But the most important thing is let us be open-minded, and have this platform to move forward so that whatever it is that we need to get to our best optimal health, we have the resources and the ability to get there.
Yeah. No, again, the healthcare should be the kitchen of every single household.
Oh, yes.
Plus homeopathy and gemotherapy, aromatherapy, 70%,
let's pile it on.
should be the kitchen and the food, and the rest, natural.
Yes.
Personally, I always, my boys, anytime that pass by kitchen, they see I'm taking some remedies. Because I don't want to be toxicated.
The house is going to smell a whole lot different for the holidays. Okay.
Yeah, and the Christmas now, the holidays is coming now. We have to do the among trees opening. Let's go to some kidneys and livers that we have room for it, right? There are some. I always say food. I categorize them. The food that is our medicine. The food that it should be eaten on a daily basis. That should be your medicine. Right. And there's food, I call it sometimes food, means when we go to get together, when people come to eat, there's sometimes food, a little bit of this, a little bit of that. But there are some emergency food, like you get whatever is available,
right,
or on the road or something, and you are really, your body asking for fuel, and you just get whatever is available. I call it emergency. Right. But if you break them down into percentage, how many times you need emergency? How many times is sometimes food? It's mostly the food that you make, and it works as medicine. Honestly, food is medicine. And
Food is medicine.
food is medicine. But we need on top, because we are living in an ocean of toxins, you know, and the toxin is the base of all this disharmony, internal disease and everything. So we need another mechanism to do the detoxification, to do the drainage, and to bring us into homeostasis. Yes. That's the main thing. What brings me into my homeostasis when I am imbalanced? My homeopathy and gemotherapy. The other one, something else. The other one, something else. It's all about, you know, for example, Dr. Steve has such knowledge on aromatherapy that knows how to bring himself or his family into homeostasis with aromatherapy. So my expertise is in homeopathy and gemotherapy. Dr. Rosenberg, something, you know, Dr. Clearfield, Dr. Grant, all of us, you know, it's all about the knowledge. It's all about the knowledge and the right mechanism. Personally, I was doing awful in homeopathy in the beginning because I was coming from clinical background, right? I mean, allopathic background, but I was not responding to any form of allopathic medications, and I had so much reverse effects on me. And at that time, I was completely super toxicated, and I was overreacting towards homeopathy, actually, because homeopathy is stirring you up, you up, you know, in order to clearing you up. You know, we call it aggravation. It's opening you up and stirring you up, and it's just, you know, taking all the, elements of disharmony and dirt out. And for me, was kind of end of life. But you know, after all that, you know, cleansing and everything happened, the only system of medicine I respond. I don't get sick anyway, so thank goodness. But I mean, any time that something happens, you know, that's the only one I respond. Again, it goes back to what you learned, how much knowledge you have, and how much experience you have with it, and the journey of your medical field. Not anything, any modality is privileged to the other one, or, you know, is better than the other one. So that all goes back to the individual knowledge, experience, and journey. So as Dr. Clark says, her journey is with nutrition. It's amazing.
Oh yeah, absolutely. Absolutely. And, you know, just bringing it all to the table, but still yet kind of keeping it basic. And you're right. You know, we live in an environment where, you know, we have toxins coming through the air. We have toxins, you know, we got toxins in our food or water.
Emotional toxin, stress, and you know, modern living is equal on natural living, and how much we are indoor, and this electromagnetic, this, you know, even
our bones,
we are bombarded by a lot of things that is causing disharmony in us. It's affecting our homeostasis. So these are something that we have to address. Now, like after this, I'm going to go for my 1 hour walk in the nature. We have a trail down my go and walk to just unload. These are something that it's all about balance, you know, it's all about balance. Dr. Rosenberg, do you want to say something?
Yes, I understand now. What are your intentions? It's really a health education program which you want to develop and to inform the people. But here we are only specialists in aromatherapy, in homeopathy, etc., etc. Important, after my opinion, the dissemination of the informations is very simple today with social media, or a lot of possibilities to disseminate the information for the not only for the patient, important to the people who want to have a better life, a healthy life, and this I think is very it's an important motivation for a platform of this time to disseminate information about apitherapy, aromatherapy, to disseminate information how to use different phytotherapeutical products or homeopathical products for important, first of all, in prevention, to prevent, in prophylaxis, to prevent different disease, and after to treat, if it's necessary, to treat different diseases. I think this is a way, and I will be honored to participate with short presentation. Here is important, short 5-10 minutes presentation, and eventually to find, it's very simple, if you record it, this presentation, to disseminate in social media, by Facebook, by LinkedIn, by a lot of possibilities, YouTube, and so on and so on.
Yes.
Yes.
Yes, Dr. Rosenberg.
You accept?
This campaign, this is health and healing campaign, is recorded all the time and is posted and uploaded in Bioquantum Academy YouTube. And I always post the link on all my media, such as Facebook, LinkedIn,
very good.
Instagram, Twitter. The link is there and is circulating among so many people around the world. This is for the public, so nothing is going to waste, and people are going to benefit from every single talk here.
Okay.
Yes, and I will send you the link on LinkedIn. Sent you to your personal chat as well. And please, and also you can visit Bioquantum Academy YouTube channel, and you see all the campaigns are posted and uploaded there. So, because this is for public, this is for people, and that's the reason you're here.
Very important.
Yes, Dr. Rosenberg, also, I would like to say, you are in Europe, right?
Yes.
Dr. Steve Chiola is the correspondent of this platform in Europe. I would like you to kind of communicate.
We are connected. We are connected.
Yes, we are connected.
Oh, you're
From
already
some
connected?
weeks.
Oh, okay.
2-3 weeks.
Absolutely.
Yes.
So,
Yes.
Okay,
And
that's great.
It's
That's
a pleasure to collaborate with a
will
great
be.
aromatherapist, because my PhD was in aromatherapy,
Perfect.
Fantastic.
antifungic effect of
Labiate, yes.
Lamiaceae essential oils obtained from these aromatic plants. And I like also very much, and I utilize very much. It's a great pleasure with a specialist like you to collaborate.
Okay,
Well,
awesome.
It's my pleasure also for you, because what I listened to about the gemotherapy that you presented, you have a very, very good expertise in this field, and I'm sure I will be learning a lot from you too.
Expertise, if a person have a lot of expertise, it's not the best solution, because have many years. It's another part.
Yeah, well.
Yes, I have about 50 years expertise, but
that's it. Well, at one point, they start calling it wisdom.
Yeah.
We rest only with the wisdom.
Thank you, everyone. You all did great,
much.
Wonderful, and I truly appreciate your presence here. And I'm sure people are gonna enjoy and appreciate what you offer. This platform is bi-weekly, the same time, in 2 weeks, Saturday from 2 to 12. And 12 to 2. I am reversing from 12 to 2, but I think I'm gonna increase it to 3 hours. I think now is half an hour past, but we are not limited to time. Not limited to time, but I mean, it's gonna be bi-weekly, and I hope you guys, you know, trying to choose a topic for next time, and just let me know. The most asked questions personally, I often ask this question is about toxications, about immunization, and natural innate immunity, and also about mental health. So these 3 areas, I'm often asked if we can, you know, have talk about in this platform. So if you guys agree, from the beginning of this platform, we talked about all of them, but now we are a different group. And if you agree, we can talk about one of this topic next time, either immunization or mental health. So you can, Dr. Rosenberg, I think you don't have Telegram, I know that, so you're not in the group to be updated about all the information, but whatever we decide in the group, I pass it to your LinkedIn, and then yes, then you know what the topic is. So thank you, everyone. Thank you, Dr. Grant. Awesome to have you. Thank you, Dr. Clark. Amazing, Dr. Rosenberg, Dr. Clearfield. So thank you so much. We are coming with the new announcements also, but let's just, you know, try to finalize it. Oh, Dr. Grant. So Dr. Grant and I, we are the Canadian correspondents. So Dr. Chiola and Dr. Rosenberg are in Europe. Dr. Clark and Dr. Clearfield are in the United States.
Thank you all.
So yes, now we're collaborating, and thank you all. Thank you so much. I appreciate it.
Thank you
so much.
Bye-bye.
Thank you very much.
Let's keep keep talking in the
Have a
group.
nice Sunday.
Yes.
Yes,
Okay.
you too.
Thank you so much. So take care of yourself, everyone, and see you all in next 2 weeks. And we're going to talk in the group. So thank you. Bye.
Okay, great.
Bye.
Bye-bye.
Bye-bye. All the best for you.
Bye-bye. You too. Bye-bye.